Today we'll take you guys on treatment of cough during pregnancy. So cough is a reflex defense mechanism in which the body uses to expel out and remove secretions and foreign particles from the airway system. Frequently, cough is caused by irritations and can also be caused by bacterial or viral infections. So there are four phases of cough. There is the irritation phase, the inspiration phase, the compression phase, and the expulsion phase. The irritation phase includes the stimulation of the receptors on the airway pathways by irritants and allergens. The inspiration phase involves the inspiration of air. Compression phase involves the compression of air by the closure of the epiglottis. The expulsion phase involves the forceful expiration of air out of the airway. Cough can be classified in three forms of categories. Three categories of the classification of cough include category of classification based on the causes of cough, which is cough can be caused by irritation or infection. Category based on the duration of cough. In this category, cough is classified as acute, mild, or chronic, and the classification based on the production of mucus, which is useful and useless cough. During pregnancy, there is an increase in the secretion of progesterone. This increase in the secretion of progesterone causes a rise in the sensitivity of the receptors on the airway path. This rise in the sensitivity of the receptors on the airway path causes an increase in the susceptibility of cough in pregnant women. Studies have shown that over 60% of pregnant women use over-the-counter prescription for the management of cough, and this prescription has caused the Food and Drug Administration, the FDA, to categorize this treatment therapies into 5 categories. The FDA category includes category A. Category drugs under category A have proven to be safe in all trimesters of pregnancy, and these drugs can be used by pregnant women as they show fetal safety. Category B. These drugs in category B do not have human studies, but are shown to be safe in animal studies. Category C. These drugs in category C do not have human studies, but are shown to be safe in pregnant women but have side effects. Drugs in category D are shown to have teratogenic and abnormal birth defects in pregnant animals. Drugs under category S are shown to have high birth defects and high abnormal defects in pregnant animals.
So I'll be taking you guys on anesthetics to treat cough in pregnancy. The three anesthetics we'll be talking about are acetaminophen, also known as paracetamol, NSAIDs, and salicylate. All three of these drugs treat cough by inhibiting prostaglandin rather than acting on the cough reflex. Among the three, the most recommended anesthetics are acetaminophen. This is because they are category B drugs at the first trimester. They also cross the placenta and are not associated with increased birth defects. The next anesthetics we're talking about are NSAIDs. They are anti-inflammatory drugs. That means they reduce inflammation in the throat and airways, thereby reducing cough urges and improving the breathing. NSAIDs such as ibuprofen are recommended in low doses for short duration. NSAIDs are also category B drugs in the first and second trimester and category D drugs in the third trimester. The next one we'll be handling are salicylates. Salicylates are not normally recommended for treatment of cough in pregnancy. This is because they can cause miscarriage and also prolong gestation and labor. NSAIDs such as aspirin are normally category C drugs in doses less than 150 mg, and category D drugs at all trimesters at standardized.
Okay, I'm talking about expectorants and antitussives. Expectorants, they thin and loosen mucus in the lungs, thereby making the mucus easy to cough out. While antitussives, on the other hand, they are called cough suppressants. They just suppress cough. And then we have types of expectorants and antitussives. Types of expectorants are guaifenesin, and then for antitussives we have dextromethorphan. Guaifenesin is an expectorant that loosens mucus in the airways, thereby making it easy to produce the mucus from the lungs. It has side effects. Side effects include nausea, vomiting, allergic reactions, which could be rare. Guaifenesin, before taking it, you have to check the label to know if there are contents of alcohol, because when there are contents of alcohol in guaifenesin, it could cause damage to the fetus. Then dextromethorphan, it's a cough suppressant. It doesn't necessarily treat the cough, it just relieves the cough. The side effects include lightheadedness, drowsiness, dizziness. It should not be used in patients that have asthma and emphysema. It should not be used in children that are below 4 years old. And then when you are breastfeeding, you don't need to take dextromethorphan, as some of the contents might enter the breast milk and cause damages to your fetus. Thank you.
I'll be talking on types of drugs used in treatment of cough, and antihistamines are an example of those drugs used in treatment of cough. What are antihistamines? Antihistamines are drugs that are used to treat allergic reactions such as sneezing, cause secretion, plenty cause secretion in the throat, itching. And antihistamines work by blocking histamine release, which is released from the body during an allergic reaction. A couple of antihistamine drugs used in treatment of cough in pregnancies are brompheniramine, diphenhydramine, clemastine, brompheniramine, and triclopyr, loratadine. Brompheniramine is an antihistamine drug used in treatment of cough, which helps in reducing rhinorrhea and sneezing, which helps to reduce cough. But it shouldn't be used in late stages of pregnancy as it causes fetal malformation. Clemastine is a good antihistamine used in treatment of cough in pregnancies because it helps to reduce the urge to cough, which helps in relieving cough. Loratadine is also a very good antihistamine, which helps by inhibiting H1 histamine receptors and has anti-inflammatory properties too, which also helps in relieving cough. Brompheniramine is also an antihistamine which is used in treatment of allergic reactions like hay fever, sneezing, itching, but should not be used in people that have underlying health conditions such as narrow angle glaucoma, high blood pressure, coronary artery diseases, and so on. Should also be used under a prescribed, like a doctor's prescription, and should only be used when the benefit outweighs the risk. Diphenhydramine is also a good antihistamine used in treatment of cough, but it should not be used in later stages of pregnancy because it can cause uterine contractions and affect the fetus. Triclopyr is also an antihistamine and should also be used under a doctor's prescription and when the benefit outweighs the risk.
Natural remedy in the management of cough in pregnancy women: honey, ginger, eucalyptus oil, salt water gargle, and warm water. Honey is a natural suppressant that helps to soothe cough in pregnant women. It has the following properties: it has an anti-inflammatory property, it has a soothing property, it has an antimicrobial property, and then we have our ginger. Our ginger has a soothing property, it has an anti-inflammatory property, and it has an antimicrobial property. Eucalyptus oil has a soothing property, it has an anti-inflammatory property, but it should be used with caution. Pregnant women should use it under guidance. We have salt water gargles. It is used to relieve cough in pregnant women, and it has a soothing effect as it helps to reduce discomfort and irritation in pregnant women. Then pregnant women are advised to take more of water. Thank you.